Maybe I should be an ER nurse, or maybe I should be a critical care nurse, or maybe I should go to the ICU, or maybe I should explore flight. And now you just learned about what's called an RN first assist. You found out, hey, the RN first assist actually closes up surgical cases for the surgeon. Hey, welcome back. The topic of this video, I just wanted to kind of clear up some misunderstandings. This is kind of more like on a pre-nursing type thing. As a paramedic, I heard people talk about their particular view of nursing before I even started. And some of it kind of swayed me a little bit to kind of stay away. And there were two main areas to me that I just kind of felt like I needed to kind of talk about. So, of course, I wrote some notes here. Just want to kind of get into it. So then that way, that same type of thinking doesn't sway your decision. So if you're a paramedic and you're looking into nursing, and these two areas I know gave me a little bit of hang up. So I just want to kind of go into it briefly. I just want to kind of talk about two things. One is the nursing profession, and the second one was what are orders? So as a paramedic, I felt like I had a lot more autonomy because I was able to kind of dictate my own treatment plan per se. If a patient got there, I'm able to look at this patient. Hey, he has chest pains, and I'm able to follow this particular protocol. So I didn't feel like I needed a doctor over my shoulder saying, hey, you need to do this, you need to do that, you need to do this. So I used to hear people, even now, I hear people saying, well, I don't want to stand around and take orders all day. I want to be able to treat my patient and everything such and such. So let me just kind of clear up this misunderstanding of what are orders. So orders are no different than protocols. Matter of fact, protocols are called standing orders. These are sets of instructions that put together a treatment plan. It's no difference. So orders serve more than just one purpose. Orders also serve to build a customer. So let me kind of explain what I mean by that. Think of going into a grocery store and pulling items off the shelf. Once you get to the end, you get to the cash register, and the cash register, the attendant pretty much adds up everything that you bought. And at the end, you pay a bill. And you take those groceries home. So orders serve the same thing. Nothing in the hospital gets done without an order. Let me explain to you. If a patient needs an x-ray, if there's not an order for an x-ray, no x-ray will get done. Respiratory therapy. If a patient needs a breathing treatment, nothing gets done if the order is not in the system. Even dietary, even for inpatients that need their particular trait, it has to be a dietary order in there for your patient to receive their meals at the hospital. Why? It's because that's how the patient is built. Those orders are line item billable actions. So if you're concerned about standing around waiting on orders, trust me, you would never be standing around waiting on orders because there's a lot to do. The treatment team in the hospital, we all work together. There's no particular hierarchy and no subservitude. Well, it's not supposed to be. But at the hospital that I work, we're all treated as equals. So if I see something that needs to be done, I bring it to the doctor's attention. And if a doctor okays it, I could put in an order myself because he gave me the verbal okay to do it. So case in point, and we do have standing orders as well. For example, if my patient is oxygen saturation drops all the way down, I don't have to run out and find a physician and run down the hallway in 3 minutes and say, hey doc, my patient's oxygen saturation is at 82. Do you think can I get an order from you to give oxygen? No, standing orders are already there. I can just go ahead and apply it because that's part of the treatment protocol. It's called a standing order. If I triage a patient out of the emergency department and the patient has chest pain, there's already a pre-order set that's already there with specific orders what need to be done to the patient. All we have to do is key in those orders to get done because they've already been pre-approved. Even something um, that's coming out the blue. For example, if I have a patient and maybe he came into the emergency department for leg pain, and now I go talk to my patient and he says, "Hey, I have some pain in my chest, and the pain is achy, it's a throbbing, it's radiating to my neck." Um, I can notify the physician and say, "Hey, this is his signs and symptoms. Would you recommend me to give 325 milligrams of per se aspirin?" And the doctor say, "Yeah, go ahead and do that." And then I can key those orders in and get that done. So don't think, change your view of what orders is, because as I said, nothing in the hospital gets done without orders, because the patient needs to be billed for them. But those are the specific instructions on this patient's treatment plan. Also, something else I just want to kind of talk about too is the nursing medical profession and what it is, and my view. I talked about it on a previous video about having a realistic view of what nursing is. And be honest with you, it's kind of hard, because you're only limited to what you see. But I noticed myself, along with some of my classmates, and even just looking at nursing, paramedic to nursing boards on Facebook, some of us are actually went through the same, or going through the same things, which is kind of feel lost, because I thought that paramedic would maybe be this creek, or I'm sorry, I thought that nursing would probably be like, this lake, this small lake that I can kind of navigate, without realizing it is like an ocean. It is huge. So sometimes you can feel out of place because you thought you may want it to be in one area, but now you're starting to look at another area, and your internal paramedic conflict kicks in to say, "Hey, well, I'm good at this, that. So maybe I should be an ER nurse, or maybe I should be a critical care nurse, or maybe I should go to the ICU, or maybe I should explore flight." And now you just learned about what's called an RN first assist. You found out, hey, the RN first assist actually closes up surgical cases for the surgeon in some areas. Now your mind starts to wonder. So I just want to kind of let you know about the nursing profession, because the profession is huge. It's much deeper than what you see on the outside as a medic. So first of all, uh, you know, there's different areas. Like, for example, as a paramedic, you have 911, you have transport, like ground and flight, you have community paramedic, and you also have some non-traditional roles. Well, nursing is a kind of like that, different. For example, we have board certs. Like for paramedic, your if you get your flight, your FPC, that's considered what's called a board certification. If you get your critical care paramedic, your CCP, or your CC EMT, those are board certifications. Well, nursing has board certification in each area that you work, has a corresponding board certification. So once you meet the standards of that, you can literally take this exam like you can take the FPC to achieve a board cert. For example, in the ED, we have what's called the C. I'm studying now for the CEN, which is Certified Emergency Nurse. We also have your TCRN, which is your trauma certified RN. So you have other areas like critical care has a CCRN. You have your floor nurses, med surge have their own board certifications. Your step down has what's called the um, progressive care certified RN, or you could say your PCCN. But nursing in general is vast. You have your inpatient, outpatient. You have your floor, you have your surgical section, you have your critical care, you have your emergency, you have outpatient like your primary care, home health, urgent cares. You also have a lot of specialty cares, like dermatology could be a specialty care, um, dealing with things like Botox. But you also have other areas like public health, you have case management, legal nurse consultants. But I think the missed opportunity that I, as a paramedic, didn't realize was more on the grad level, because at the grad level, now you start to really get into the breakdown of healthcare. My only understanding was only for the APRNs, or the advanced practice RNs, which is more like your nurse practitioners or your clinical nurse specialists. But literally, there's a lot of opportunity, not only at the master's, but at the doctorate level of nursing, because you do have healthcare leadership. I didn't realize that there's a large majority of the hospitals that literally nursing has a big leadership hold on. The director of my department is a nurse. The director of all our departments where I work, they're nurses. We have a chief nursing officer. We have a whole hierarchy within the hospital with nurses, and that because of healthcare leadership, nursing has a seat, an equal seat at the table, along with everyone else. You have nursing informatics. You have education. There's just so much. But I was blown away by meeting a first assist nurse. I had no ideas. I'm sorry. I had no idea that you had a nurse first assist. You guys may need to look it up, but I'm here to tell you, as a paramedic, you're not going to have a realistic view of nursing. You have to do your education. You have to do your research. Whatever you got to do it. So, if you guys have any questions or whatever, keep in mind this is only my view and this is only my experience. I'm not an expert. I don't proclaim to be an expert. But anything I can do to help you guys navigate through nursing, because it is complex. It was complex for me. Just leave a comment, and I promise, when I'm not working, I'll try to get to it as quick as I can. Okay. All right. And see you guys later. Thank you for tuning in.